Hopkins County 4-H.
Well, I answer the phone by going, "Thank you for calling Bright Star. This is Heather. How may I help you?" And then if it's one of our regular clients, they'll just go about their normal, letting us know what the condition is that they're needing to talk to us about, or,
By the way, there's one coming in.
There's one coming in.
Let's see how.
Bright Star Veterinary Clinic, this is Heather. How may I help you? Hey, Miss Hughes, I'm doing good. How are you doing? Yes, ma'am, we did get the food you left her. Yes, ma'am. She's doing good. She has more oozing from her incision area. Dr. Larson thinks her fat's trying to dissolve there. So what we're doing is I hydrated her and I cleaned it this morning, and I send you home with Ace for her. Okay. Okay, because I'm gonna have to give her a little bit to get her. I need her still, so she's not moving around a whole lot. So, but well, I can give her some for today, just whenever you get a chance, if you can run it by and drop it off. But it's easy, so we're gonna keep an eye on it. No, we started her on the antibiotics, so hopefully we caught it in time. Sometimes that happens if they have those areas with the fat tissue where it's more fatty there. And sometimes that happens, it'll start trying to dissolve. So it'll happen there. I would have to ask her all of it. Yeah. Yeah. It happens, but we get them taken care of, and usually it's on more cats than dogs, but Maggie's a little overweight, right in that area. Just a little bit. Just a little bit, but she looks good just in that area. She's got more fatty tissue. So, well, she's happy. So that's what counts. So, you're welcome. All right, you too, Miss Hughes. Bye bye.
So basically, what would you like to do when you're discussing a phone conversation and checking on a client that you just did? And what information are you trying to collect from the client?
Well, the information you're trying to collect from the client is the situation of what their animal's in, what's going on with the animal. But if you have the animal already here, you're just describing what the condition of the animal that it's in, and let them know how they're doing and what treatment you've started, and let them know what Dr. Larson has told them.
So I noticed that you were giving some advice over the phone. When do you define when you're gonna return it from you into the veterinary?
Well, when you're giving advice over the phone, you need to kind of think of how you're going to word it, because if you don't word it exactly right, they can take it in the context of going to do something else, or and then if you don't know exactly how to word it, you need to ask them if they could please hold, and you go consult with the doctor and go from there.
So any particular, how to make it friendly over the phone? Do you? I noticed that you greet them, of course, because you know the patient right there. Mm-hmm. So you start asking things about the patient right over the phone.
Yes.
So to plan that conversation to go. Do the people normally like to talk to you off the bat? Do you have to, talk to them a little bit about the situation, a little bit to get them to talking? How does that happen?
Those are more of the new clients. You have to get them more to talk, and if you have our regular clients, they'll talk and they're comfortable with you and talking about what's going on. But the new clients, they don't really know how to go about it, and you just start asking them questions, general questions of, say if they're coughing, you start asking how long they've been coughing, and go from there. And what have they been doing to treat it, if they've been treating it at home or if they've seen another veterinarian. And then with a new client, you always get their name and their phone number, if they'll allow you to. Not all new clients will. Sometimes they're just calling a price check, and they're not going to give you any information at all. So
when you say there's people out there just checking prices, what does that mean? I mean, there's people just trying to know how much it's going to cost.
They're some people they'll call and want to know how much an exam is, or they'll want to know how much a spay or a neuter is, and some they don't want, after you let them know, that's all they're wanting to know. But you try and start up a conversation with them, at least try and get their name and maybe call them by their name and ask what the animal's name is. But sometimes they don't want any of that. They're just like, I'm calling for this price and that's all I need. And sometimes they'll tell you their price check, and you might never hear back from them again.
Do you normally give them their price of the procedure you're talking about?
We give them a rough estimate, and we tell them it's a rough estimate. Now it may be more and may be less. So we just kind of give them a rough estimate. And we let them know that if it's a little bit more, don't try and go on the computer and schedule an appointment or anything until they're fully trained. Because if you get on there and you schedule something and you don't quite understand, then somebody has to call that client back and fix the problem or something. And don't get on there and going, and what, and all that as well, because then the client's thinking, maybe they're being a little rude. But I think the best thing is if they do answer the phone, they need to start off with a nice greeting, say the clinic name, their name, inform the client that they're just a volunteer with 4-H and that the receptionist is busy at the moment, and take their name and number.
So there is a time that you prefer them just to take the message and move.
Yes, and that's what we usually try to get them to do, is just refer to getting them a message and just make sure it's not an emergency. Now, if it's an emergency, place them on hold and grab the nearest vet tech or the receptionist or even the doctor if they need to.
What about the voicemail? How do you handle that? Do we like to leave a message like we do if you're too busy, or do you rather have them pick up the phone and take the message?
I would rather have them pick up the phone. If it's during business hours, I'd rather them pick up the phone so that the client knows that we are here. But the clients, they'll know you're busy if you can't get to it, but our voicemail always does pick up. But you're not guaranteed 100% of the time that client's going to leave a voicemail. So I think it's very crucial to pick up the phone.
So do you think, is your opinion that people will not leave a message, they just wait for another time and call again?
Yes, they'll wait.
Another clinic or something?
Yes, they'll usually wait and call back later, because usually you get the phone call of, I called you earlier today, but I know y'all were probably busy. But we have really good clients, so it doesn't bother them because they know how busy we are. So, and that 99% of the time they call back. Or they'll call back and say, I left a voicemail and I know y'all were probably busy and I know you haven't had time to check it yet.
All right. So if you want to state your name and your role in the clinic just for the record.
Okay, my name's Heather Brinkman and I'm a veterinary technician. I've been here almost 2 years now. Almost, I believe so.
How do you like the job in the clinic? Do you enjoy it?
I enjoy the job. It does get stressful, which all jobs do, but you have to take it one day at a time and take every situation, differently, and just stay focused and try not to get frustrated. But everybody gets frustrated, but that's with every job. And just stay focused and keep the animals your number one priority, and make sure they're healthy and safe and they're tended to.
Okay, well, thank you very much.
All right, thank you.